I am Paula Miller. I am the outreach manager for membership at ACHA. I've been there for about 6 years in that capacity, but I've been with the organization as a volunteer or board member since the year 2000. So I'm very passionate about what I do. I am also one of those patients that's at the age of being at risk for coronary artery disease, and I'm very grateful to be able to say that in a few months I'll be going on Social Security. So that's a pretty amazing accomplishment. I'm a tetralogy patient. So that said, moving forward, ACHA is the first and only freestanding adult congenital heart advocacy organization in the country. We are a nonprofit. We were founded by patients in 1998, and our board of directors still consists primarily of patients or family members. There we go. This is a picture of our founders, and I apologize that it's a little blurry, but in the late 1990s, two young adults who met on an AOL chat decided that they wanted to start an organization, and that's Karen on that side, and then Anthony Cordero all the way over to that side. And those were the two young adults, and they were in their young 20s at the time, and their parents agreed that they would help them. And that's how ACHA came to be. They didn't live together anywhere in the same city. Anthony's from Austin, Karen is from Boston. So in 1998, ACHA was incorporated and run out of the kitchen of Karen Klein. And that's how it started. We're now over 12,000 members strong, both professionals and patients, family members, and friends. So we're very, very proud of that. And this picture was actually taken at their first board meeting in 1999. So who are we today? We're obviously a little bit that same organization. We are really the trusted partner of all who are living with CHD and all who are taking care of patients who have, adult patients who have congenital heart disease. We have a community and we are a support network. We are not a support group, but we do provide support for all of the above. We know that congenital heart disease is a chronic, lifelong illness, and our message is to get that out there, to get the awareness out there. We want people in care, back in care, and in the right care, so that they have a life, they can live a life that is complete and full. So we bring together not only our patients, as I said, but we bring you, the medical community, together to provide education on our population. And because there's limited research in the United States, and most of our data is extrapolated from Canada, but we work really hard to connect everybody who's involved in this to advance the standards of care. And although we aren't a part of writing the guidelines, we endorse the guidelines from the ACC and the AHA, and those, as has been said already, are that all adults who have ever been diagnosed with CHD or who've had heart surgery as a child be seen at least once by an adult congenital specialist. We push this, we strongly believe it. For me personally, it was a lifesaver, and so I'm very passionate about anyone I talk to trying to get them into the appropriate care. This is our mission. It's pretty much what I've already said. And our members, just right now, I've already said this too, these are just who we are. We just have a whole bunch of people. As far as the CHD patients go, we have patients who come to us and are already in adult congenital care, and their providers have said, go to the ACHA because they are the organization for all of us. We have people who've been lost to care who I get phone calls as the member outreach manager, and they say, I just found out I'm not cured, I'm not fixed. Oh my gosh, what happened? I thought I was fixed, I'd never have to have surgery again, and now they tell me I have to have surgery. We get similar questions from people who are seeing doctors in the community who do not have training in CHD, and then we talk to people who are transitioning. And these are a little bit about our programs, educational programs. I'm going to talk about just a few of these in a minute. Advocacy, and then access to quality care, and I mentioned the guidelines, but there's others too. So let me just talk a brief bit about our programming, a little bit about our education. We have monthly webinars that are done live, but are also archived and recorded on our website. They go all the way back to 2009. Last week we had one on tetralogy of Fallot. These are done by members of our medical advisory board who volunteer their time and expertise, and they are geared towards patients and family members, but they are certainly appropriate for professionals who are wanting to learn about adult congenital heart care. The Monday after Thanksgiving, we have one on pulmonary arterial hypertension, and then we'll have a whole set starting again in 2017. Our clinic directory, this just shows you where we know that there are programs where there's adult congenital care across the country. These are self-reported programs. The data is not verified, but if you go to our website and you want to refer a patient to an adult congenital heart program, and if you're in Houston, you know where to refer, but if you're not, let's just say you're not in Houston or you have somebody calling from out of state, you can go to our website and the data is on there. You can search it, you can compare it, and you can lead them, to make that decision. We're institutionally neutral, so we don't recommend particular centers. We give them the information, the patients the information, and say, get on the phone and call and ask these questions. And so we help them we really try to empower them to get the right information and to be their own advocate. These are our ambassadors. This is a great program. These are adults with CHD, family members, and even friends of people with CHD who can provide support and resources if you have patients who are struggling with an issue or are going through a challenge. These folks have all been through it, and this was really the premise that ACHA was founded on, was finding support and being with someone just like yourself or who's similar to yourself, because there are no two CHD patients, adults or children, who are alike. We're all very, very different in our anatomy, our physiology, and our psychological status. So these folks can help. They're great people. We have regional events in different parts of the country, and we had one here in Houston last year. We have printed and web materials. I encourage you to, if you haven't stopped by and to say hello to me earlier, please come to our table and see some of our materials. I have some for you to take home. The two at the bottom, the passport and the travel directory, are two of our biggest and most important pieces, I think, although they're all important because they are great for patients to take with them in their purses, in their pockets. And even though this is a day of technology, technology is not always available, it doesn't always work. And I personally carry a passport that has all my medical information in it that is so weathered in, but it's still usable. That is from way back in the early 2000s. So please stop by and I can give you a copy. We co-partner with Children's Heart Foundation on congenital heart walks across the country. We've raised over $7 million in the last, I think, 5 years since the outset of this to support both of our programming. And I believe there's going to be one in Houston, I've been told, this year or next year. So quickly to advocacy, which is very important. We advocate because it's a political process. We have to get out there. We have to speak for ourselves. Your voice matters. We have a legislative assembly. It used to be called Lobby Day. Every year we go to DC, we go see our senators, our congressmen, and we tell them what we need in terms of funding for the Congenital Heart Futures Act, which is a bill that was passed in 2010, and we're trying to get it reauthorized. It was passed, it was funded in 2012. So far we've gotten every year about $2 to $3 million. We really want 10 million, so we're going back in March. We're going to ask for it again. This bill, and this is not, I'm going to just say this is not a political statement at any means, but it is embedded in the Affordable Care Act, which encompasses more than insurance. It's a major document. We're worried about this. And this is really, the CDC has authorized funding for states to start doing surveillance data on adults and adolescents, and it's important data that we need in the United States of America to move forward. So we've got to get you, and even if you can't go to DC, there are many, many things you can do at your home state and on the phone and email and that kind of stuff. So you just need to join us. You'll get the advocacy alerts and where we tell you what we need you to do. So I hope you will come and join us for that. And these are just some of the things, the grassroots things. Quality to care becoming one of our biggest things, always has been. Our ACHD accreditation program is relatively new. It took a number of years to get it together, but it basically will be accrediting centers based on 16 different program criteria, and I'll show you those in just a minute. There's 2 levels, as you can see, and new applications just came in, and the deadline was the end of October. We got 15 new programs that you saw sort of on that thing that are applying to be accredited programs. The 5 pilot programs, they've been through the process, they still are in the process of being finalized, and I think they will be announced soon. We hope that this will be a huge thing for patients to be able to get the appropriate care into adult congenital heart specialists, and that insurance will pay for it more readily. Fingers crossed. But the basic thing is we want patients to be in the right care, and this is a tool to help them get there. That just shows you the criteria. One of the most important things is that if you'll see sort of in the middle of it, number L, is patient-centered care. Every program has to have a patient family advisory council, and they have to have some component of patient-centered care in their mission statement. To be accredited, they have 2.5 years actually to meet this criteria, of that particular criteria, because it's non-core. But that is how strongly we feel that patients need to be involved and need to have a voice in their care. And we sponsor a fellowship program for adult congenital heart programs through the ACTELION pharmaceuticals, which help to fund the first year of a 2-year fellowship program, which is great for people who are taking the ACHD boards, because soon they will be required to have that kind of training through an ACHD fellowship. Although we weren't responsible for this, we were one of the voices that said to the professional organizations, we need subspecialty board certification for adult congenital heart care. And so this was done. It also encompassed a whole lot of years to get there, but the first boards were a year ago. The second boards will be next October. I believe they're every 2 years, at least at this point. And then eventually there's the grandfathering right now, because we have some wonderful providers who learned to take care of us and came in via pediatric cardiology and general cardiology routes and didn't have formal training. Now we're lucky to have some fellowship training, and that's grown. Those programs are growing. So I hope you'll join us. Professional membership is very inexpensive. It's $95 a year. If you join today, you can get a $10 discount. For cardiac care associates, it's actually 65 doctors, it's 95. We have institutional membership. If you have more than 3 members, we'll give you a discount. And if you give a tax-deductible gift of $250, you can have membership for $10. So that should, and I can sign you up today. You get discounts on all our educational materials. The most important thing I want to point out is our conference, which you also get a 10% discount on that. It takes that down pretty significantly. And there's a chance to come to our conference, and I'm gonna be wrapping this up in a second, but a chance to come to our conference because Hurricane Matthew forced us to cancel it in October, so it's rescheduled June 2nd through 3rd in Orlando. So you can go to our webpage and sign up, and if you're a member, you can even join there, and if you're a member, you'll get a 10% discount. And it is a unique opportunity because it is a professional conference with CMEs and also patient and family members. So we have 2 tracks running simultaneously. So with that, I will say our future is really, really bright. And I'll ask you the question, won't you help us to reach all the adults with CHD so that they can live life unaffected by congenital heart disease and thrive throughout the lifespan? And that's it, folks. Thank you very much for your time.